Connected Development is a non-governmental organization founded in 2012 with a mission to empower marginalized communities. So we've been doing this work since 2012 and we've been able to expand across the 36 states and some African countries. Our work is centered around education, health, and environment. We won't talk about environment, talk about the wash and the extracting. So today, Connected Development tends to actually work in the area of ensuring accountability and transparency. And we have a product called Follow the Money. Follow the Money is an initiative which was created to man this aspect of connected development work. And we've been doing that by tracking funds meant for rural communities, ensuring that funds are released to achieve what it's meant to be used for. And at this moment, we started the Follow COVID-19 Money in 2012 and in 2020 when the pandemic broke out. And we've done work so far. And today, with the support from Oxfam, we've been able to actually take it to the second phase. And we decided to visit in Kwara State and actually work with them to understand what they've been doing so far with COVID-19 funds, what have been achieved in the state, what is expected, and what we are going to see next.
I see. So from all of us at Connected Development and Oxfam, we have come to be with you to have this discussion with you. So all of the items that we have highlighted here are in our policy brief on Follow COVID-19 Money. So it's really imperative that at your own legal, we have to back to our dear permanent secretary, that you could look at some of the content of what we have here and then be able to get abreast with what we do. On behalf of the Connected Development team and Oxfam team, we present this to you, our dear permanent secretary, which is the policy brief and advocacy brief from us to ensure that we are able to curtail COVID-19 in due course and make proper arrangements to see that we are not negatively and harmfully impacted by the effect of this pandemic COVID-19. Thank you.
Our guest, the Oxfam International Connected Development Headquarters. You are welcome to Kwara State and specifically welcome you to the Kwara State Ministry of Health. We are happy seeing you and meeting you, and we are also delighted that you have brought a topic of interest to the state government and a topic of specific concern to us as a ministry. We are also happy to share with you that Kwara State has been in the forefront of the COVID battle in Nigeria. I don't know how your own organization will eventually rank us. Some organizations have done the ranking in the past. They say FBN, they did an index where it was published in terms of preparedness, and they rated Kwara as number 4. We agree that Lagos and Abuja are essentially driven by the federal government. But if you look at all the states, the other state that was taught was Cross River. So, meaning that the active state really in the forefront is Kwara, even though we are scored fourth in the country. So we'll be looking forward to your own findings as you interact with us, look around our environment. But like we also see, and we must have read somewhere, we have a very big hospital. So let me say the biggest hospital, formerly in the annals of Kwara, was dedicated to the COVID-19 infectious diseases.
You should be seeing records of COVID-19 spending published on your website, donations given on COVID-19 spending. So everybody is on the same page about what you have been able to do. And if there is any other portal also existing, and then we draw attention to people, this is what is that. So ultimately, what we are targeting is that we know we are in the second phase of COVID-19. In the first phase, people were more afraid of the virus. But now, go into the street and see what is happening. They are no longer observing social distancing. no longer wearing their face masks. All the protocols and guidelines are no longer being implemented by people. And it's not what you police, because people will stay in their schools, stay in their offices, and they are not able to apply to this. And then we all know that we are not yet out of this way. So we need to, put in more effort and then make sure that these things get better for all of us. And we will all be happy that at the end of this, our people are not so adversely affected by the pandemic. I would say yes, we've been able to fight the good fight and we curtailed the COVID-19 pandemic.
So the government has got the work bank from the work bank, and the federal government got the loan from the work bank. So that is why we are keen to that program. And it's from now, particularly in May, the program is supposed to come. And the whole idea is to mitigate the effect of the COVID and these poor and vulnerable people. Thank God, in Kwara, we have a social register to capture these vulnerable people. So whenever the program commences, I think we know what to do, because they have already have a register for all the poor and vulnerable quality. That's what they are doing implemented. So on the issue of processes, I think when I got there, I was appointed as counsel last year. Initially, it takes about 2 weeks before you get the payment. When the other transaction is over. So immediately I got to the office, I tried to review the process. If you have any transaction with the government, you take 24 hours. Yeah, we are sure you are going to get them.
Part of the reasons why we are here is to say that the activities that your office and then the various offices like Ministry of Finance are all in public view. The right information is passed out so that they have that trust in you. They have that confidence in your office that you are not just providing this. In fact, if you ask an average Nigerian about COVID-19, they will say it's one of those things that the government has brought up to eat money in their language. But you and I know that it's not exactly true. The government is also putting in place things to ensure that they protect the people and leave them not devastated when we are all out of this COVID-19. So we manage the losses, we manage the system to ensure that we are all fine. This is basically why we are here. So, as part of our advocacy, we have printed our policy brief, which should galvanize and put together all of the things we have highlighted here. We want to ensure that there is free access to healthcare facilities for everyone. We have just come from the Ministry of Health, had a long discussion. We are going to go to the isolation center and do capturing of some of the things they've also put in place, so that ultimately, when we are done with this, it also provides healthcare facilities. So you are in isolation center, not just because you want to contain COVID-19, but because you have a need to provide healthcare facilities for the people. And then afterwards, they have access to some of these things. We also want to ensure that there is transparency and accountability in the way we provide our information to the people in the portals, in their websites, and all of that, and ensure that we all put substantial effort to make sure that we contain COVID-19 and your office, the economic impact of all of this over time. So at your own convenience, it will be imperative for you to just go through this. From all of us at Connected Development and Oxfam, we present to you this policy brief and advocacy brief. Thank you very much for having us in your office.
Thank you very much, sir. It's a great pleasure. From our own end, we have been working assiduously to ensure, because it's a World Bank project, and you know World Bank project has a lot to do with accountability. We have been trying as much as possible to be accountable for whatever we do, not just the organization as an individual. So we have that accountability framework on ground. And of course, one of the primary objectives of the project is to assist the beneficiary in such a way that they will be able to build resilience to shock. And when you talk about shock, we're talking about a pandemic like this COVID-19 that came up. So how well are these beneficiaries at the end of the day able to help themselves out of the problem?
In about 65 countries of the world. We livelihoods, and also to good governance as well. And we'll continue to work with government to promote revenue mobilization across various levels. The issue of diversification is one of the core issues at the moment now. So we support government in terms of tax transparency, fair taxation, budget transparency, participatory budget system, and all of those kinds of work. And within this period when COVID hit, we thought it's important if we also look at how is government utilizing those COVID interventions basically, and also support government in ensuring that we see transparency and accountability within that kind of work as well. We are spread across about 18 states in Nigeria, and at the moment we are trying to slim down to also make more impact across states. And Kwara seems to be one of those states where our program direction is actually focusing on in the next 5 years. And we thought it's important we also use this opportunity to also, get to see the authorities here, understand their policy flow, and see how we can align with it as well. So let me leave it there. There's a lot to also tell you about our program, but for the sake of the kind of meeting we are having, let me leave it there. Thank you, sir.
So for the sake of this project, we got support from Oxfam. So it's Connected Development, which is a home-based Nigerian-grown initiative, which is spreading fast to African countries. As a matter of fact, a team is in Cameroon now. They left from Ghana to Cameroon, and they will be going to Malawi soon to also step up the Pan-African initiative known as I Follow the Money. So Follow the Money is a Pan-African initiative that has spread into various other countries outside of Africa. So we are working with Connected Development on this project, which is basically on COVID-19 funds. For Connected Development, we work in 3 thematic areas: education, health, and water, sanitation, and hygiene. So on this, it's imperative that we highlight why we selected Kwara State. So we were to implement this project in 6 different states in Nigeria. And then at some point we have written to Kwara State asking for information, and then Your Excellency, the Ministry of Finance actually provided the information that we needed and attached even a newspaper publication on spendings of COVID-19. And so we said that since there is that level of transparency and accountability already emanating from the Kwara State government, Kwara State is a state to implement the project. And so it informed our selecting Kwara State. So aside that, we also noticed that amongst all the states in Nigeria, that Kwara State has established the audit, social audit process, which is commendable to the state because it intends to ensure we have open governance to a very large extent. And so we started the implementation in the first phase, and this is dovetailing into the second phase of the project. So what we intend to do is to ensure that state governments are able to even have access to funds that will enable them to respond more effectively to COVID.
So advocacy, that's what we're hoping that you guys can be of help to us. And you can be assured, well assured, that whatever you do for us, and you come back to do your audit, you'll be sure that we make sure that funds all, whatever you give to us, the best way. I also believe that we did some tests. We've gone to so many local governments, reached out to so many local governments where we do tests for COVID. Recently, an NGO, I can't remember the NGO, sent some big funds to us to buy more testing materials, So that's another thing we think could be of help to us, because a lot of people, when you have fever or cough, I tell them that when you have fever or cough, you have to go to the hospital and do COVID tests. My started as a cough. I thought it was just normal cough. And when fever came, I said no, it's COVID. I've not had fever for 35, 40 years. If I sleep inside a mosquito infested area, I will not have fever. Some people have fever, me, I won't have fever. But when I had fever, when fever came after 2 days, the cough started on Friday. By Saturday evening, Sunday morning, I couldn't get up from my bed. And I said to myself, no, I called the doctor, this is COVID, it's not fever. I haven't had fever for years. So, a lot of people don't go to the hospital. Nigerians are dying. But Nigerians, when they fall ill, they go to chemists and get drugs. They don't test, they don't do anything. It's when that drug can help them, they go to hospital. But in Europe, civilized society, people go straight, the facilities there. And that's why they have records of people dying. Americans will say 500,000 people have died. There's so many people from poor homes, in villages, in small towns. When they have fever, they'll drink the traditional medicine and they will die. And they'll say, oh, fever killed her, cough killed her. No, it's COVID. But we don't have records. So, the last time we'll ask you is enforcement. When we do so much, we spend so much money on enforcement. And in Nigeria, if you don't force people, they won't do things. They won't do the right thing. And I always wonder when I go abroad, you see the same Nigerians, when they're in London, America, they will line up in shops, anywhere they line up. But when we land in Murtala Moyo Airport or Imadi Azikwe, you will see those same Nigerians who have lined up like civilized people in jumping queue as if there's no law. So in Nigeria, to get things done, to get people to do the right thing at the right time, you must apply some legal force. So we've done so much with the police and the other security, but it's not enough. It's not enough. So I welcome you to Kwara State, and I hope we'll be able to partner together to move Kwara together forward. Thanks so much. God bless.